anything to add or any additional comments to make.
But there are a lot that you say, what? And I'm like, okay, I'm not reading that one.
But one of the things we've gotten into some discussion about is, with some of the examples we've been throwing out, how would you make the world better for older adults and so forth. And then one week especially, I got really argumentative with almost everybody posting. But this is the why, in a sense, because in order to improve interventions, you've got to think about what's not working and what's wrong with the ideas that you have now. And one of the things I sometimes find frustrating about gerontology is a lot of our services and even a lot of our thinking about what to do for people has been the same for about 3 or 4 decades. And like the solutions are, and some of the solutions like are in the category like, yeah, they would work if people would actually do it. You know, I mean, that's like the whole reason you have like a field of health psychology, for example. People don't do stuff. People don't take their medicine even when they've got diseases, much less do preventing stuff. So, you know, you've got to kind of get into that level of thinking about, you know, what's not working so well, what's wrong with things. Caregiving has been one of my areas. I started to say until recently, although it looks like I'm still doing it. I'm working on 2 reviews right now. And one of the things that's always intrigued me about caregiving that a lot of people in the field glossed over is that caregiving interventions have mostly had much, much smaller effects than psychological interventions for people with clinical depression, which seems like a really odd finding. But people kind of keep saying, well, caregivers, it's better than doing nothing. Much better. And if you kind of get into the critical mode, you're like, why isn't it working better than it is? Then you get this flow like you see here from the first generation interventions up to the 3rd generation interventions, where you keep stepping up and getting things better and better until, arguably, it looks like we're on the cusp here of being able to do some really interesting, effective things in cognitive enrichment with people on an intervention basis. Being the eternal optimist that I am, I wouldn't have put any money on this 5 years ago. We'd be at the point that we are. And there's also a lot of crap that's being sold to people that tell them doesn't do anything, but come back to that at the end. The other thing, and I was just during the break, I was looking back, I sort of thought I had a slide, but I must have gotten distracted and not done that. You know, we talked about source memory going away as you get middle-aged and beyond. You know, one of the things that having that source memory problem does to you is you keep thinking that because you thought of something really hard that you actually did it. Anyway, I wanted to say a little bit more about where I think the cognitive activity, not interventions, but just how cognitively active you are, what we think we probably know about the effects of that, other than what I've told you, which is that there's a good chance that a lot of it is just the fact that you wouldn't be that cognitively active if you weren't already really, really bright, and you wouldn't be able to keep it up if you weren't continuing to be really bright. I think it's pretty clear that it has to be a really long period of cognitive activity. I don't think there's any evidence in the crossword slide kind of points to this from the day's talk. I don't think there's really any evidence that deciding when you're, say, 65 to start working crosswords or Sudoku is going to do you very much good. There's a fair amount of evidence that the amount of cognitive enrichment, cognitive activity, and like your occupation or in lifelong hobbies and avocational interests have an impact. There are a couple of problems with knowing what to make of that literature. One is that, as they point this out, and they actually have some interesting reasons for kind of discarding this objection in Herzog et al. hopefully that'll tantalize you to look and see what those reasons are. But, they point out that a lot of times people are using like multiple outcome measures of cognition and taking refuge in whichever ones happen to be significant, but it's not the same ones in different studies. This is a bad strategy, but not an uncommon one. You also see this a lot in relationships between like social factors and psychological factors and health outcomes. You do about 20 biomarker measures, and you report the two that are significant or the one that's significant. And if you look at, when you do reviews, it turns out that it's not the same one. If it's the same one in lots of studies, then you're on the way to something. But if it's different ones in different studies, it's more of a mess and more likely that it's random. They're not as pessimistic about that, what I just said. The other one I think is kind of intriguing is that they generally have classified occupations into three kinds of cognitive demands or cognitive enrichments. And one is data-driven, which almost never seems to be related to preserved cognitive activity. Seems odd, but there you are. One is more cognitive problem solving, and the other one is more social interactive. And which of the last two pays off is different in different studies.
I'm sorry, the third one was social.
More like social interaction with people, so you have a job that's high in social contact and interacting with the public. A lot of studies show that it's the social stuff that keeps you cognitively enriched, cognitively functioning. And some of them show that it's more like the problem solving kind of component. But it's different across different studies, and it's a little, and just in general, as they talk about it, some detail in the article, as you can see, it's all top of this. There's not a lot of agreement about what kinds of cognitive activities go into this mix, and the people using are diverse both across leisure activities, especially, and how jobs get classified into the different levels of cognitive demand is less than crystal clear. Okay, on to physical exercise. So physical exercise and cognition, why would it work? Well, diseases interfere with cognitive abilities, cardiovascular disease, diabetes, and cancer, and also exercise prevents these and other diseases. Reduced cardiorespiratory function, even without disease outcomes, results in poor cognition, and of course, exercise, at least aerobic exercise, builds up your cardiorespiratory functioning. And finally, animal models suggest that exercise changes brain structure and functioning. This is by and large the same body of research at the animal level that was being cited a decade or two ago as showing that enriched environments, and hence higher education, build up dendritic connections in the brain. But it turns out that when you're talking about rats, enriched environments mostly mean exercise wheels and little tunnels and things to run around through. And so one of the obvious differences is it's not so much that the rats are thinking, wow, what a wonderfully complex environment I'm in. I need to think about this. They're getting lots of exercise, whereas the typical lab rat day is kind of sitting on your butt, eating your rat pellets, waiting for the experimenter to show up. So the corollary is probably more like, are you going to the gym rather than are you going to graduate school in college? So I kind of shifted the interpretation now. So basically the same enrichment literature, what happens in the rat brain is now on the side of physical exercise rather than higher education. So in fact, physical exercise training shows moderately strong effects in normal aging and sort of similar effect sizes but more generic outcomes with dementia. They point out, they sort of lump in everything, including like improved behavioral, reduction in behavior.